Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory. It makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Alka, is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD in skin, specializes in dermatology, cosmetology, and hair transplant. Currently, she's practicing as a consultant dermatology and also own her clinic at Chhatrapati Sambhaji Nagar, Aurangabad. Dr. Alka has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Alka also know the need of the awareness for the patient, so she has given time to give talks at various platforms across the country. Thank you, Dr. Alka, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live.
Yes, thank you so much, Dr. Mona, for such a kind word.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to talk about hair care in current scenario. So when we talk about hair care in current scenario, the most common problem which is faced by all of us is the hair loss. So can you please enlighten us with your profound experience, like what is hair loss, what's normal, and when to be concerned for?
Right. So first of all, you have to understand what is the cycle of hair. It's a made up of three stages: anagen, catagen, and telogen. So one is a growing phase, resting phase, and shedding phase. So we must know that this duration of the total hair cycle varies according to individually. So everybody cannot have a long hair. Everybody cannot have a hair till the, you can say, floor. Every the God had gifted every hair their own lifespan. So it's depend on genetic constitutions. Ki what is the length of the hair? Second, the amount of hair fall. The routinely daily 50 to 100 hair fall a day can be considered normal. But what happened? Many time patient is having telling me I have a fear of washing my hair because when I wash my hair, there is a lots of hair which is more than 100. What actually happens? The patient will not comb their hair for 2 days. So the normal hair count, which is every day is 50. Suppose 50 is a day one, 50 is a second day. So when he wash or she wash her hair after 3 days, so total number of hair fall, which is normal, is 200. So that time, this scenario make the patient stressful or little panic. So nothing panic in that. You have to think it is a hair loss of last 3 days. So 50 to 100 daily hair loss is absolutely normal. Second, so when should we consider it should be abnormal or the more hair loss? So when you see a hair everywhere on a pillow, on your hairband, on your dress, the relatives or the family member complaining ki you have a, we can see your hair on the floor, or your maid is complaining ki now हर दिन अभी बहुत सारे बाल मिल रहे हैं मैडम आपके फ्लोर पे. So you have to concern. One more thing, your hair band टर्न मतलब जो हम ट्विस्ट टर्न करके जो 2-3 बैंड्स पहनते हैं फोल्ड करके, दैट आर इंक्रीज्ड. बट दिस डजंट मीन कि ओल्डर हेयर बैंड, नए हेयर बैंड का सपोज आई हैव यूज 2 फोल्ड्स, so same hair band now I'm using, I can make a 3 folds. This indicates there's a volume loss of your hair. Now regarding male, how they can consider, they can able to see their scalp which is previously not. They can touch their scalp easily when they touch their hair. This is one of the indication of a significant hair loss. Or you can compare with the older photographs. You can see my older photographs. Many times I ask my patient, show your older photographs. So you can compare with your older photographs. Ki, ma'am, I have this much volume, and I can see my normal scalp skin. So this is time to go to your dermatologist.
Okay, that's quite interesting, doctor. So, doctor, now that we know that what is hair loss and what is normal and what's not normal, so can you please also tell us, like most of the people who have hair loss, they keep thinking like, why me only? Why me? Why me? So these questions make them, very feel very like lack of confidence in something like that. So can you please enlighten us, like what are the general causes of hair loss?
Right. First of all, patients should understand कि stress of hair fall will lead to more hair fall, right? So any physical or mental stress will increase your hair fall in addition to your internal or external cause. So internal cause is like your genetic constitution or any autoimmune disorder. If you have a thyroid problem, if you have an iron deficiency, the problem which is inside your body, that can lead to hair fall. This is the internal cause. Second cause is an external cause like a pollution, bad quality of hair products, you can say a repeated ironing or the chemical or the hair procedure nowadays what undergoing the people, that can lead to more hair loss. So you can divide it broadly internal causes and external causes of hair loss. So once we define or we divide the patient according to that, and we have to proceed the treatment according to that. And for that we can do a basic blood test like we have to do ferritin test, b12 test, thyroid and vitamin d. These are the basic four tests you must undergo when you are thinking of, or you can able to find the causes of hair fall easily with the help of this test.
Okay, that's quite interesting, doctor. So there are like a lot of causes, and it's better to visit the doctor to get the root cause know and then take the treatment. Okay.
Yes.
So doctor, there are like you also said before, like diet play an important role, and in that there are so many nutrients, and one word called nutraceutical is getting a lot of focus nowadays. So can you please explain us like what is this nutraceutical and what is the role of this nutraceutical in hair health?
Yes. The first of important is what we can do in our normal diet and what we can add to our supplements. The list of the nutrients which is important for hair are biotin supplement, amino acids, protein, and not only this, in addition to that, green tea extracts, omega fatty acid, melatonin, this all important in females, specifically in Indians people, are ferritin. That's also very common cause of hair loss is a low ferritin or low hemoglobin. So that all supplement according to male, as male required more calcium. So male supplements have the different constitution, and the female have a different constitution because the body are different and the requirements are the different. So basic, I can suggest you a broad spectrum: amino acid, the protein for the a normal person, antioxidant like green tea, omega fatty acids, and vitamins like mainly B12 and biotin, which really help for the you can say hair growth. And one important thing, some are hair stimulator out of that, and some are antioxidant and anti-inflammatory. Because of that, like some nowadays there are some herbs like tulsi, all are playing a good role in anti-inflammatory purpose. They prevent further inflammation, further infection to our scalp, and that will lead to prevention of hair loss.
Okay, quite interesting, doctor. Like you said, this herbs and all. So there are a lot of these plant extract like grape seed and like
Yes.
omega fatty acids and so many things are there. So do they promote hair growth and are they very useful in managing hair growth or
I
hair?
can I can say they promote the hair growth. They help rather than being promote. They help to growth and they prevent the inflammation. So I tell you, कि if they have anti-inflammatory property, so there is a chances of infection will be less, inflammatory process will be less, and the cause because hair loss because of inflammation will be less. So I can say they help the or they help to reduce your hair loss and
Mm-hmm.
faster your hair growth,
Okay. Okay.
right? The
Quite.
oxidative damage because of external cause that
Mhm.
reduce because of this all supplements.
Okay, that is quite interesting. So these supplements are like help us to reduce this inflammation and help the treatment to help like get the hair
Gain
back.
your hair as early as possible, you can
Yeah.
say.
Okay,
Yes.
quite interesting. So, doctor, like after hair loss, another very common problem which is faced by all of us is the dandruff. And dandruff is something like sometimes we ignore, and sometimes we just buy so many shampoo and we keep trying that chala jayega. And
Yes,
we
yes.
so does dandruff is like should we take the dandruff as very seriously? Does dandruff cause hair fall?
First of all, understand whether you're suffering from dandruff or not. Just a flecking of your scalp, it doesn't mean you have a dandruff. After a wash, if I wash my hair today, if I see a flecky scalp, in second or third day, you can, and it's repeatedly happening, you can think of dandruff. But after a absence of 3 6 days of hair wash, मतलब मैंने पूरा week hair wash नहीं किया है, then I can see a fleckiness of my scalp. It can be absolutely normal, because normal sebaceous gland, the secrete the secretions which will accumulate on your scalp, and that can lead to white fleckiness. So first of all, it's important whether you're really suffering from dandruff or not. Directly jumping into anti-dandruff product is not good, because whether you're really having that problem, first you have to confirm that, first of all. Second important thing, when you're taking anti-dandruff shampoo or anti-dandruff lotions or anything, first it depend on your grade of dandruff, how much dandruff you are infected or the affected your skin, because dandruff will not infect or affect just the scalp, it can affect your eyebrows, nose folds, or behind the ear area. So you have to see whether it's really that much bad, because according to stages of dandruff, the treatment will decide. And of course, a dandruff is a type of yeast, which is common cells. Common cells, in a sense, everybody have that common cells. Everybody's scalp have that yeast, but number of yeast is more in the population who is having significant dandruff problem, and that what they eat are fatty acids of the skin and the hair, and that lead to damage to our hair root and scalp. So that will lead to again hair fall. Definitely, dandruff will cause a hair fall. It's depend on the grade of dandruff what you have. So first of all, confirm whether you have dandruff or not, and if it is severe, definitely visit your dermatologist.
Okay, so very quite interesting. So even like to for dandruff, we should know the grade, like which grade of dandruff we have, and then only we should treat
Yes.
ourselves, or we should go to the
First of
doctor
all, you
instead of
confirm whether you have a dandruff or not.
yeah, yeah,
Yes.
yeah. Okay, that's quite interesting. So, doctor, like, there is one thing which is very common in our Indian society, and all our mothers do that, like oil champy to get
Yes.
relaxed. Or they also say that if you use the oil and get the champy, you will get stronger, thicker hair, and the hair will grow more. And people apply it and sleep for overnight, thinking that next morning the hair will be very long. So, like oiling hair is a boon or a ban? What do you think? What is the
First of
fact?
all, oiling of hair, it's this lower end of your hair is a dead tissue. Very true. From where we got a new hair is from the hair root, right? Two different concepts. Second important thing you have to think, ki hair oiling is a, you can say, a lipid based solution that will condition your hair. So it is not ki it will not help to make your hair better. I cannot say it will help to make your reduce your hair fall. No, it will reduce your frizziness of your hair. And when you apply oil, I can say specifically coconut oil, which is very good for the skin, because the triglyceride level, the size of triglyceride what we have in coconut oil is as equal to the opening of your skin. So बाकी जो बादाम oil और ये सब है, ये skin लेती नहीं है. It will take a specific amount of only lipids. So of course oiling will help it, rather than reduce your hair, it do conditioning effect. क्या होता है, हेयर स्ट्रैंड्स पे यू हैव टू अप्लाई ऑयल टू टिल द टिप, सो योर क्यूटिकल्स जो ऐसे ऊपर नीचे है ना, वो दिल बिकम स्ट्रेट, एंड योर हेयर बिकम स्मूथ एंड स्ट्रेट एंड लुक लेस फ्रीजी. Second, to apply, whether we have to apply a oil on scalp or not. We can apply a oil and scalp, but it must on clean scalp. हमारे यहाँ पे डेली रूटीन क्या होता है, कल मुझे बाल धोना है, 4 दिन हो गया है, सो आई कैन अप्लाई टुडे नाइट. पर 4 days का डर्ट ऑलरेडी वी हैव ऑन आवर स्कैल्प, और उस पर हम क्या कर रहे हैं कि ऑयल लगा रहे हैं, मसाज. तो व्हाट वी डूइंग, वो मसाज से जो डर्ट है, ऑयल तो जा ही रहा है, डर्ट भी अंदर जा रहा है और जो कंटामिनेशन है वो भी अंदर जा रहा है. That can lead to folliculitis and infection more. So important is oil is helpful, but it should be on clean scalp. And oil can apply on hair, lower end of hair, as a conditioner.
Sure.
You can say pre-wash conditioning effect, right?
Mm-hmm. Okay, so
Anything
like for conditioning and to lose that frizziness of hair, the oil is good and
important on clean
important
scalp, clean hair,
in on
right?
clean hair, and also not keeping it for overnight. Just apply it and then wash it off in few hours.
Because that can lead to again acne on forehead and back. Specifically, the people who's having dandruff, they
Uh-huh.
must avoid oiling their scalp because yeast will more, the production of yeast will be more.
More. Okay, okay, okay. So oiling hair is oiling hair is like it's like it is good, also not good if you have a excess dandruff. Okay, quite
Excess
interesting.
dandruff and dirty scalp, you can say.
That dirty scalp. Okay, quite interesting. So doctor, now my favorite part, can you please give us some important tips for healthy hair?
Um, First of all, I can say, don't be panic just seeing your 100, 200 hair you comb after 3, 4 days. Whether first clarify it's really significant or pathological hair loss or not. I'd seen my patient, they come directly to me, I have a hair loss and I want treatment, I want PRP again. Directly they jump for the treatment modality, they want PRP or they want serums and they want supplements. First of all, you have to decide whether you are really suffering from that or not. Second, according to age, you must go your hair routine. I can say a good diet, some sabji, roti, dal, chawal, a complete Indian food you can have. A fruit, one seasonal fruit daily will really helpful. And antioxidant, you can have a fish, which is really good for hair. And second important thing, wash your comb and towels regularly because repeated use of same comb, which you can now you can see your all combs, they're already having a dust or you can have grease. So that clean hair again become dirty after using that comb. So washing of your hair is as important as washing your comb and towels, including pillow cover too. Third important thing, just applying random oiling every day and keep it for through 2, 3 days will not work. In the city like Aurangabad, जहाँ पे बहुत सारा धूल है, मिट्टी है, so that will again increase your hair damage more rather than being helping as a conditioner. So apply oil for the shorter time and apply to whole hair rather than applying only on the scalp root. uh, Fourth important thing, don't jump to directly OTC brand and the anti-dandruff shampoo things ki 90% hair fall prevented by this particular shampoo or this serum. This is all myth. No shampoo will prevent you hair loss by like directly 90% because shampoo will stay for 10 to 30% only, 10 to 30 seconds on your scalp, and it will not reduce your hair fall by 90%. Shampoo will only work as a cleansing property. There's nothing to do with your hair fall, right? And having good sleep again will help you to reduce your hair loss. At least 7 to 8 hours sleep, because melatonin hormone, which is very important for your hair growth and graying, prevention of your graying of hair, will secrete only after your sleep. So have good sleep, specifically for younger population. Switch off your mobile or keep away mobile 15 minutes prior to sleep. Don't go for screen time till you have a sleep. It will really affect your health and skin and hair too. Anything else? Just I can shortlist this much.
Yeah. I think that's this was like the most like effective solutions which you gave us today, and like you said that even the pillow covers are important, not only like the comb hygiene or towel hygiene, but also the pillow cover, which is like
Yes.
very important. We should take care of all the step, and although also the diet, and also like if someone is want to eat antioxidant we can get from our food also, which is like you said, fish. So that's quite interesting and very good tips, Dr. Which you gave us today. I'm sure our viewers have found the session very helpful and very informative, and they must be enjoying it. So, doctor, can we take some live audience questions, because they've been asking me so many questions? I'll take one or two.
Yes, thank you so much. Yes.
Yeah. So, doctor, I live in a small city with no prominent dermatologist. And is there a way to know if my hair follicles are dead or in a dormant condition?
Right. So we can go for a test like dermatoscopy, trichoscopy to help what is the quality of your hair root, right?
Mm-hmm.
So
Mm-hmm.
it can be seen, but it required a dermatological setup and the scope. For under with the help of that, we can see the quality of your hair roots and what the falling stage or the how much hair is
Mm-hmm.
on the good stage and how much falling, how much are falling.
Yeah, yeah, yeah. Okay, quite interesting, doctor. Another question is, doctor, I have been facing androgenic alopecia from since past 2 years, and I have been visiting many doctors, and all the doctors give me only vitamins and minerals. My hairs are not coming back. Can I visit you? Where is your clinic? And also, do I need to take these vitamin minerals for whole life?
Right. So most
So
of the
most,
patients actually is having androgenetic alopecia. The
yeah.
name itself suggests it's a genetic cause.
Okay.
So till date, we cannot change your genetic pattern. The thing
Mm-hmm.
which is happening, if I am suffering from androgenetic alopecia at the age of XYZ, I just want it's 30 may I have an androgenetic alopecia. What I can do as I am young, I want to look a little better. So the doctor will do just postponing the hair loss which is happening now to future purpose. We cannot change your genes. We can
Okay.
restore your hair growth and we can maintain your hair till you
Okay.
want. I'm very clear to that. It's
Mm-hmm.
and of course there is a role of nutraceutical, but more you can go for other and anti-androgen products which will
Mm-hmm.
help you to regrow your hair more better as compared to supplements.
Okay, so these people can get the hair back. I mean, those who are okay, okay. Treatments
Yes,
are
yes,
available.
yes, of
I
course.
need to
Yes,
visit
treatments are
very
available there, right?
yeah,
To maintain
and
it and
also
increase it.
okay, and also he wants your appointment. He's been asking your clinic.
Um, Tell him to drop his phone number so our team will contact him as soon as possible.
Okay, okay. Let's see if he drop. I'll let you know.
Otherwise,
So
please
another
message our clinic number and details
mhm,
in chat box as soon as possible.
yeah. Okay, okay. Another question from our audience is, Doctor. I think this question we should take, because I think most of the people do this. Doctor, I've been facing hair loss. Can I take oral minoxidil or apply minoxidil by myself?
Again, I'm telling the same thing, ma'am. First, you have to clarify whether you have a really hair loss or not. First thing. Second, minoxidil will work for androgenetic alopecia,
Mm,
depend on the stage of the patient,
mm,
right?
mm,
So first, we have to first confirm whether you have androgenetic alopecia or not. It will
mm,
not help for the telogen film, the hair fall, because many people may you heard मम्मी से भी सुना होगा आपने कि hair loss होता है प्रेग्नेंट डिलीवरी के बाद जब बेबी हंसता है तब टाइफाइड के बाद 10th के एग्जाम के बाद दिस इज नॉट एंड्रोजेनेटिक एलोपेशिया एंड इन
mm,
दिस सिनारियो मिनॉक्सिडिल will not help you. The
mm,
minoxidil will help only when you have an androgenetic alopecia. So first, I am requesting to that patient ki first confirm whether you have a minoxidil androgenetic alopecia or not. Second,
mm,
oral minoxidil required some basic investigation done. After
mm,
that, only you can take minoxidil under
mm.
the qualified dermatologist prescription only.
Okay, okay.
Right,
Quite
there are
interesting.
some cardiac side effect, we must know about that, and
Mm,
that must be taken with the due prescription of dermatologist only, not by
mm.
own at all.
Oh, yeah. So don't become your own doctor. It's better to
No,
visit.
not at all for minoxidil, not at all.
Yeah. Okay. Quite interesting, doctor. So I'll quickly take the last question from our audience because we are running out of time. So, doctor, I am also from, hi, doctor, I am also from Aurangabad, and my daughter is 12 years old and she's having a lot of gray hair at such a young age. And I don't know why she's having it. Can we come? Why she's having it? Can we get your appointment?
Yes. So I can broadly said a gray hair. I can say कि I we will my
12
team
years
will drop a contact number and address in chat box as soon as possible.
old.
Second, gray hair can be reducible and can be treatable if cause is what is the cause of gray hair. At
Mm,
such an early age, we
mm,
have to examine the patient and let's see how it, whether there is a genetically association is there or some deficiency is there. So according to that, a treatment plan will decide it.
mm.
Okay, so don't
Okay.
try anything on 12-year-old kids.
No.
You have to consult your own dermatologist, whatever you nearby you have, or you can visit us. No issue.
Okay. And also one more thing, like, can these premature gray hair control? It
Yes.
can be
Yes.
controlled. Okay.
There is a treatment options available for graying of hair,
Mhm.
and they are satisfactory. I'm not saying 100% proof as a other cause of hair loss, but they are reduction of graying of hair up to 60% to 70%.
Okay. Quite interesting, doctor. So there are treatment
Options available.
available,
Yes.
and yeah. Young children do not need to worry. They should visit to the doctor with their parents. So quite interesting, doctor. So finally, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
Have a good diet, good sleep, and um, take care of your hair as you care of your skin. Same.
So everything we like all the good habits which we are not able to sustain it for a long time, we should follow it to have a good hair, good skin.
Nothing fancy diet, sabji, roti, dal, chawal, and fruit. You can have and have a good sleep. Yes.
Yeah. Normal good life, healthy life is
Normal happy. Yes. Sound life. Yes.
oh, quite interesting, doctor. So thank you so much, doctor. It was like you shared so many expert advice today with us today, and you answer all the questions, and you shared all your expertise with us today, and so many information. And I think the viewers have found the session very, very helpful. Thank you, doctor. It was delight to have you, and thank you so much for your valuable time. Um,
Thank you,
like
Mona. Thank you, Dr. Mona. Make me so much comfortable.
Yes, but I think the time was a little less. I think we should, because there are so many questions from our audience, and I think we'll take your appointment again for a new topic and for hair and skin condition, and we'll talk
Yeah,
more and cover all the questions of our viewers. Thank you so
yes.
much, Doctor.
Thank you so much.
Yeah,
Thank you so much.
yeah, thank you,
Yes.
ladies and gentlemen, for joining us today and asking so many and participating so actively and asking so many questions to our doctor. We'll come next time. We'll join again. And for today, we are signing off. Have
Yes.
a good